We've got a new warning from the American Heart Association that women need to pay attention to this big time. The organization says nearly 60% of women in this country could develop some type of cardiovascular disease by 2050. That is a significant jump from the 44% of women who are currently living with heart disease. So here to talk about this is CBS News medical contributor and editor-at-large for public health at KFF Health News, the lovely Dr. Celine Gounder. I heard the numbers and they sound very scary to me. What's behind it, do you think, the big increase?
Right. So we're seeing increased rates of high blood pressure, diabetes, and obesity, all of which are risk factors for cardiovascular disease. Those conditions are starting earlier, and women are living longer, so that adds up to a longer lifetime risk of developing cardiovascular disease.
I always pay attention to this because my dad died at 47, heart attack. Mom died at 60. I've outlived both of my parents. So my heart history is very, very bad. But I keep hearing that it's really bad with black women in particular.
That's right. So we were just saying by 2050, women in general, you'd see rates of 60% of women having cardiovascular disease. We already have that level of cardiovascular disease in black women. 60% of women over the age of 20 who are black already have cardiovascular disease.
Why is that?
Well, they have higher rates of high blood pressure, diabetes, and obesity, which are driving a lot of this. And much of this is also related to the quality of the food you're eating, ultra-processed food, and so on. Do you have time and the ability to exercise on a regular basis? You know, and a lot of this goes back to socioeconomics.
Yeah.
You have access to these things.
So women of all color, what can we do to protect our heart health? You've mentioned a couple of things.
Well, pregnancy, young women, I just want to say those are two really big takeaways here. We're seeing, again, rising rates of obesity, high blood pressure, diabetes in younger women. If you are of age to be pregnant, you are of age to have cardiovascular disease. And what we're seeing is sort of a two-way direction here where pregnancy is a major stress test on the heart. If you develop, whether it's preeclampsia or gestational diabetes, that is a sign that there's something wrong. But if you also are planning a pregnancy, you should do everything possible to make sure your blood pressure, your diabetes, your weight are under control heading into that.
All right, Celine, let me change topics here. President Trump's Surgeon General nominee, Dr. Casey Means, faced some really sharp questioning on Capitol Hill yesterday during the Senate confirmation hearing. I want to play a little bit of an exchange that she had with Republican Senator and physician Bill Cassidy. Watch this.
Do you believe that vaccines, whether individually or collectively, contribute to autism?
The reality is that we have an autism crisis that's increasing, and this is devastating to many families, and we do not know, as a medical community, what causes autism. And until we have a clear understanding of why kids are developing this at higher rates, I think we should not leave any stones unturned.
So, Celine, what do you make of her response? And she's also facing some scrutiny because she let her medical license lapse, which you say could affect public confidence. So those are sort of two really important issues that the American people are looking at.
Look, do we need to study what causes autism and how best, especially to treat it, manage it, support families where somebody's been affected? Absolutely, absolutely. But whether MMR measles vaccines cause autism is literally one of the most studied questions in medicine. And so to spend more taxpayer money studying something that we actually have a very good answer to, well, that's just a waste of taxpayer money.
And pushing the narrative.
And pushing the narrative. And to not be clear that, look, we have studied this, asked and answered. Of course, there's a place for uncertainty and nuance in many public health conversations. But this is one where you need to be clear, especially in the middle of measles outbreaks around the country, that you should be getting your MMR vaccine, you should be getting your flu vaccine, that these things actually work and save lives.
And letting your license expire, your medical license, that seems pretty basic. True?
That's pretty basic stuff, and it really calls into question, are you keeping up with continuing medical education? She's a residency dropout. She never finished residency. So she hasn't actually practiced in the healthcare system.